has had horrendous issues for a long time. She's seen specialists and tried lots of expensive products, but nothing is working, and she's got welts. It's not even acne anymore. It spreads beyond her face, her neck, and into her hairline. Is this normal for perimenopause? And can you offer any advice on where she might go next? I think it's understandable. It's really, really troubling her.
Yeah, horrible. And particularly when I think, if you've tried lots of different things and seen loads of different people, and I imagine had loads of tests and not got any further forwards, it's horrible. Um, I would be so skin changes can be a symptom of perimenopause and menopause, absolutely, but I would be looking down the histamine route,
Mm.
very much so.
Yeah, really interesting as well. Sometimes to think about, how I think what you and I have understood with histamine over the years, Corinne, is often somebody has probably been quite sensitive most of their life, and it seems like perimenopause just exacerbates everything.
Yeah.
And so, when you think back, if you were somebody that's perhaps always had issues with sort of seasonal seasonal I know I was going to say allergies. They're not really allergies, but just seasonal hay fever, that type of thing. If you really react when you get stung by an insect, good, or always a good indicator. And another one is amazing. If you have a glass of wine, poof, and you
Yeah.
start flushing,
Yeah.
quite an indicator. Just reacting quickly to going from hot to cold. If
Or
you
with exercise.
yes,
Yeah.
exercise.
Yeah.
Um, but so, and sometimes even if you're just wanting to see does this get any better, just trying some over the counter antihistamines for a little while can, if it just reduces some of those, can be an indicator that maybe that's the route to
Yeah.
explore.
And the classic, which you may have, is if you can write on your when you're flaring, you can write on your skin with your fingernail, and you'll be able to read it because it comes up in red, and you actually can read what you've written.
Yes.
Um, but that is a classic sign of histamine. And it is if you've always had sensitive skin or reacted to different products, or if you've been sensitive to medicines, that seems to fit as well, or kind of any bowel issues, headaches, migraines, um, kind of
Hypermobility?
hypermobility. Yeah, there seems to be a link emerging with ADHD as well. Um, there's also, yeah, it's really I would say that's the next place to
Yeah.
look. And what's really important is that you can get better.
Yeah.
And we've seen people who have been housebound, haven't we? And
Yeah.
because the symptoms they can pretty much destroy your life. They can be awful. And they can be very varied. And you can have a whole load of negative tests and people saying, we don't know. Um, and yeah, people can get better and lead normal lives again. And so it's really important to keep going and search for the answer. And also, which is really hard when you're very symptomatic, but also work on the stress side of things as well, because that can really help. And actually, HRT isn't absolutely contraindicated either, because although you're adding estrogen back in again, you may be pushing estrogen levels up. HRT, if it's introduced carefully, can actually level out any hormone fluctuations as well, which can really help with skin symptoms. Well, all histamine symptoms. You just have
And
to do it in a slightly more careful way.
well, I think again, it's that thing that ideally what you're wanting is some dietetic support alongside um, working with a menopause doctor who gets
Yeah.
histamine. There ain't many, trust me. So it's why we tend to work with Dr. Corinne so much.
Yeah.
Um, And something else had crossed my mind as you were saying that. Yeah, often, not always, but I think we often see patients who really are beginning to feel like they are being given the cold shock, shoulder by general medicine. You know, they've probably often been potentially given a diagnosis of things like fibromyalgia, ME,
Mm.
IBS,
Yeah,
PMS, these
yeah.
syndromes of symptoms that still a lot of people don't really know what to do with. And
Mm.
so,
Mm.
so often these women have just been from pillar to post,
With a
almost
huge
beginning
load
to
of
just feel like
investigation
a
often.
nuisance. Yeah.
And where, if that's the case, then it's you need to kind of draw it back and think, well, what's the underlying process going on that's causing all these different symptoms?
Yeah.
Where's it all started from? And just going right back to there and working on that, healing that basically. So you're looking at the skin as for this lady, but also you'll be looking at stress levels, you'll be looking at diet side of things, gut health, sleep, hormone health, and just looking at supporting all of those almost like pillars of health. And there are medications that you can use for histamine as well,
Mm,
that can be really, really effective. So
yeah.
don't give up, basically, don't give up.
No.